A big uptick in summer travel and people holding gatherings is leading to a new wave of COVID infections.
It's being fueled by new subvariants of the Omicron strain, BA4 and BA5.
And as monkeypox cases rise, the CDC is recommending high-risk individuals get the vaccine. Lots to discuss today, as usual, with UW Health Chief Quality Officer, Dr. Jeff Pothof. Jeff, thanks for being with us today.
Hi, Dr. Pothof. Good to see you.
Good to see you, too.
We're talking about the new wave of infections. Well, I was under that wave this past week. And fully vaccinated.
Yeah, Mark is one of many people that are getting sick now. They're testing positive and they're getting very sick. So is that the new variants that we're talking about, 4 and 5?
It's possible. We've seen this switch now from what a lot of us became familiar with, which was BA2, to BA2.1, 2.2, which is kind of going away, and we're seeing these new variants of BA5 and BA4. They cause similar disease in the sense that from actually getting the disease, it would feel the same, but these two variants are a little bit better at escaping both our vaccine protection, but also previous infection, even previous infection with an earlier Omicron strain.
Mark, why don't you tell Dr. Pothof what your symptoms were? You had everything.
Well, I don't think doctor can hear me.
Yeah, he can hear you. We can hear you.
No,
oh, he can't hear. Oh, you can't hear him. Oh, sorry about that.
You could tell him that, I had a fever of 102 for a while and a severe cough. It lasted a couple of days until I started taking the Paxlovid.
He had a high fever and a very bad cough for a couple days and then took the Paxlovid and then he felt better.
Yeah, and that's a pretty common scenario. I think a lot of folks think now that COVID is this just really mild disease and it kind of like slows you down a bit but isn't too bad. But for a good number of people, it's legit. Like, it really knocks you down. You don't feel very good. Fevers. And then a plug for Paxlovid. It's got great data behind it, especially if you have a couple risk factors for severe disease. It can really decrease the likelihood that you come see someone like me in the emergency department.
Well, if we have these new variants we're talking about, how does that impact whether or not you should get a booster? I mean, is the booster going to protect us against these new variants, or are we needing to be talking about an Omicron-specific vaccine?
So it's a little of both. Right now, our current vaccines and boosters, they may not protect you, especially months after you've gotten them, against any symptoms at all. So you may be like Mark, where you have a fever, you're not feeling very good, it's not fun, but it doesn't get to the point of being dangerous. They protect very well against severe disease. Now, if we can create an Omicron-specific variant booster, let's say BA5, and BA5 is still the dominant strain when that booster is available, say September, October, that's the best case scenario, because what that means is not only will it still protect against severe disease, but it's likely that it'll protect you much better against any symptoms at all. So you may come in contact with BA5, not even know it. But the trick is matching up that specific vaccine with the variant that's dominant at the time. That could be tricky.
Right, and always changing, yeah.
Yeah.
Mark, go ahead.
All right, I think we're out of time, but we're going to get to monkeypox, but I guess we'll get to that next week.
Oh, let's just quickly ask him. The CDC said if you're at high risk, you need to consider getting the monkeypox vaccine. Who is at high risk?
Yeah, so right now, we don't fully understand it, but the highest risk population for monkeypox is men who have sex with men. So if you're in that category and you have multiple partners, you would absolutely be the person who we'd recommend you go get vaccinated against monkeypox at this point.
And that vaccine is available?
It's available. Sometimes it takes a little work to get that dose. It's not like you can just go down to Walgreens, but talk to your healthcare provider and they can get you set up.
Well, hopefully by next week we'll have Mark back on the couch. This is the new normal now. Everybody's going through this.
Right.
But he appreciates you coming in. Good to see you today.
Thank you.
We'll be right back.